Hey everyone, I'm Jen, and I own a veterinary technician relief business.
And I'm Michelle. I own a veterinary technician mobile house call business.
And you are
And you are
listening
listening to
to Endless
Endless
Journeys,
Journeys,
the Vet
the
Tech
Vet Tech
Odyssey
Odyssey podcast.
podcast. In this podcast, we will be discussing and meeting with credentialed technicians who have created their own path with business ownership within the veterinary space.
Our goal is to help inspire burnt out vet techs before they leave the industry altogether through our stories and the stories of other vet tech business owners.
Hey everyone, you're tuning in to part 2 of our latest episode. If you haven't listened to part 1 yet, we highly recommend checking it out first to get the full context and enjoy the entire conversation. Both parts are packed with insights and stories that you won't want to miss. Thanks for joining us, and let's dive back in. So moving on from that, can you share a success story that reaffirms why you chose this path? Or would you say that you've already I feel like you've already explained it a little bit on
But we'll always take
why.
more.
Actually, there's been a few. Like, one of them was one of the dogs I came into a trainer actually contacted me and she says, "Hey, I need you to be a second pair of eyes on my personal dog. I'm not understanding. He changed his behavior. He's starting to act pretty aggressive. And it started out with one family member and now it's spreading to other family members." So I'm like, well, I don't usually handle this, but if you need a second pair of eyes, I'm more than happy to have a look, I guess. So I went over to the house, and as I was watching the dog very carefully, I saw the lower back part of the area twitch. And every time I saw that lower back twitch, I saw his hackles starting to go up and his body stiffen. And I was like, oh no. Oh no, this is not good. And I ended up pointing it out to her and telling her, hey, you and I go to the same vet. Mention to the vet what I mention here, because I know she'll listen. And I think there might be something a little bit more physical going on. And I think that's probably why your tactics aren't really working. And have you tried this tactic out? And she says, no, I haven't. And I said, well, let's try also this tactic out too. Once we get medically this fixed, I said, I'm not a vet. I can't diagnose, but I just want that vet to look at that. And sure enough, that dog had an extra vertebrae on its back and elbow dysplasia. And
so painful.
yeah. So, that,
But nice work to you, though.
yeah. As soon as we got that dog on pain control, that dog turned out to be the friendliest dog ever. Like, body was relaxing, happy as can be. Yeah, we were all so happy and ecstatic. We were just super happy that that was a quick fix.
Yeah.
But with that, there was another dog too that a trainer that was talking to me about reactivity too. And it was such a well-known trainer that I was like, I don't even know if I want to take this case. I know. And my husband says, do it. Just do it. I'm like, this is a well-known trainer, Brian. I think she knows more than I do. But my husband was like, just do it. I was like, okay, fine. So I took her in and we evaluated the dog, and I noticed that there was some tactics that she hasn't tried yet. So I told her some of the tactics. Well, the next day I took my personal dog to the vet, and she's in that relationship with that vet. And the vet comes up to me and says, I heard that you're working with so-and-so's dog. And I said, yes, I am. And she says, do you think this dog needs medicine? And my eyes went wide, and I was like, oh my goodness. Not yet. Not yet. I don't think so. And she says, any client that you think needs medicine, come and talk to me, and I trust your opinion. And to hear that from a vet was it humbled me, and it really respected me, but it was a lot of pressure to hear that from a vet.
Yeah.
But I was like, yeah, well, here's the deal. If the client thinks that the dog needs medicine, it's between you guys two. But if I do think, I'll tell him to go to talk to you about this, and you determine what medicine needs what. Okay. But But just
Yeah.
to hear that from a vet and to hear them like respect my, just to hear that they're going to have a look whenever I have concerns about these things is just so humbling and respectful.
Right. Yeah. No, that's awesome.
That is a very good feeling. I've had that happen a few times. I had one instance where a dog was getting, I've been seeing her for about a year or so, and she's an older dog, and she was on her nail trims. She was getting like more and more agitated with me, and she's like 12 now, and she's like a medium sized mutt, and she's always done so well. And I noticed that she was just like getting stiff. And I told my client, I was like, well, I can't, I got to stay out of that diagnosing area, that prognosing area. I was like, I believe Rover might be in pain, and that's the reason why she's starting to get more agitated versus when I first started seeing her. And I was like, I want you to take her to her vet. I know who her vet is. Her vet, I don't know them, but I know them in a professional setting. Like you said, you kind of know what vet practice, what style. And I told her, I was like, go talk to your DVM. You tell her everything that I'm telling you. And I told her she'll probably prescribe a couple of different types of medications. I gave her the rundown of what she may or may not do. And my client walked up in there and was like, yeah, Michelle sent me. And she was like, whatever you want. I'm like, that's what your DVM told you is whatever you want, because I sent her up in there. It was Novox. She sent her on home on Novox. And then my client told me she did not notice how slow the dog was going up and down the stairs until she put her on Novox. And then all of a sudden the dog was going back up and down the stairs. But it was that slow, gradual decline that they didn't notice until we got on pain meds. And then she was going up and down the stairs fast. And then on her next nail trim, she was a lot more limber. She let me do what I wanted to do, and she was back to her normal state. But just the fact that I know her DVM is, and I'm like, okay, let her know this dog is doing this, this, and this. And then the veterinarian's like, oh, you see Michelle? Yes, well, whatever the veterinarian trusts my observation, but also she took the dog in as well. And so, yeah, it's a very symbiotic relationship that me and you have with veterinarians. And I wish more veterinarians would see more of what you're doing out there to demonstrate what we're doing for them and their clients. Yeah. Any other stories that confirm or reaffirm that path?
Goodness. I'm still kind of shocked right now that my training technique is still working. I've been having like imposter syndrome even when I first started. And one of my well-known trainers, like she's the one that butt kicked me out into the business. She's the one that dragged me into the room and was like, hey, you can do this. And here's how you do this business. And she showed me how to make this business work. And she's the one that I'm thankful. She's the one that grabbed me and threw me off the cliff. I always say, because without her, I wouldn't see the results that I have been seeing with all my clients and pets. And I'm always still so shocked whenever I ask the clients to do this technique. And then I'm coming back expecting, like little results or no results. And then I'm seeing this drastic improvement. I'm like, it's working.
I know. It's always us. It's like we have to have more faith in ourselves. Sometimes people have more faith in us than even we do. And then we do it successfully, and then we're like, oh my gosh, I can't believe it worked. And then it's like, yeah, it's weird because we know that we know what we're doing, but then when it works, it's just that affirmation of like, oh, okay, yes, I did it.
Yeah.
And yeah, no, I totally get that. And I think anybody even just starting in their own business and working out things like that also have that exact same experience.
So, Daphne, with all of this said, what advice would you give any technicians who are considering starting their own business?
Oh, they are going to hate me for this. You have to work at a vet clinic for the amount of years. Michelle, you mentioned it, for the amount of years that you recommend. You have to. And the reason why is I mentioned in the last time is you got to have relationships with a certain amount of vets. You got to have relationships with a certain amount of staff. You got to have relationships with the clients too. You need to have those connections. Those connections are what's going to help your business go. Because if you're going out there in a blank slate, it's going to be difficult to help you get started. If I didn't have those resources with the trainers, if I did not have those resources with my last jobs and those vets and many other different people, I don't think I would be where I am now. But because of where I am now, it's been my business went very smooth. I was not expecting it to go this smooth, but it really went smooth because of all my resources. and all the people that I had connections with.
That certainly helps, having those connections. Um, I feel like you have to work in a vet clinic for a while because I do have technicians who will inbox me who I've been in a vet clinic for 6 months. I discourage them. I feel like and you can respect this one. You need to learn how to read a dog's body language. If you
Yes.
can't read their body language, just you and the owner, oh, you're setting yourself up for not a safe situation. Also, I feel like you need that clinic experience to read body language and to get to know like health problems, behavioral problems, because your clients are going to come to you for help, like we were talking about earlier. And you have to be able to be very knowledgeable. And so, like you said, yeah, you definitely, multiple reasons why, definitely need to have a good foundation. I came to my town and I was brand new. I still, I didn't know any of the DVMs here. So I actually had no connections coming in here, which is quite odd because you had the connections, but I didn't. But that's super important that you have those connections for sure, at least so you have some starting clientele base.
And honestly, working at those clinics with the staff and the vet and everybody, they offer some good advice. They offer you some good techniques to work with those animals. You know, do not let your pride get the best of you. Always be humble and always listen. You may not like that because that takes a lot of pride out of you, but listen. You really don't. And I still don't know anything. Like, I mean, there's some things that clients show me and I'm just like, ooh, that's interesting. I need to look into that. But, yeah, listen to the vet and listen to the staff. And do not be shy to question the vet. Why are you doing this? Why, and the staff, why are you doing this? And I did that throughout my whole career working in private practice and working in shelter medicine. The vets who will respect you will answer in a scientific way. The vets who will not respect you will just say, just because I told you so. And what I've learned is the vets that will respect you in a scientific way, those are the ones that love to think and love to educate and will help you every step of the way going on forward.
Yeah, and it also takes time to learn it takes time to learn those skills too. I mean, I think a lot of people think, oh, nail trims, anal glands, giving medications, what's so hard about that? But those are skills. If they weren't skills, then anybody could do them. Clients wouldn't have to come to us to be able to perform those skills. So it takes time to learn those skills. But you also, like you said, communication skills, how to build connection. Those are all skills that you have to learn, and that all takes time. And yeah, you have to build up that foundation in a clinic beforehand. I was just talking to one of my girlfriends the other day because we have there's a couple of new girls at one of the clinics that I relief at, and one of them has pretty much gotten bit on every single one of their shifts, if not every single one of them. And I remember the gal I was talking to was kind of making a comment about it. And I corrected her a little bit and I said, look, they're baby assistants. And it takes a long time to be able to read that body language and to be able to acquire those skills. Because there was a patient that was not cooperative with them at all. But then when me and that VA got a hold of that patient, the patient was very good. And then, and the gal was like, wow, maybe that dog just doesn't like me. And it's more of like, no, it takes time to acquire those skills, to acquire that energy, and to be able to know how to work with reactive patients. That doesn't just come. And I remember even talking to the VA and saying, it took me a really long time to acquire that skill, so that patients who are reactive won't be as reactive with me. There's a lot of things that you can learn in clinic. So I think you're spot on with that.
You have room to make a mistake at a clinic. You have a little bit of wiggle room to make a mistake at a clinic. You do not have wiggle room at your own business because, your reputation is on that line. But when you make a mistake on the clinic, they're forgiving and they can help you show how to fix that mistake that you make. I remembered, like, at the shelter, I would help a lot of the staff in the beginning, and they would actually bring me the newbies so that way I could teach them how to read the body language. And I would always ask, and because I hated closed-ended question. I always asked open-ended questions. What are you seeing that tells you that this patient is nervous? What are you seeing that's telling you that this patient is comfortable? And what would you do? And they were very opened. Their eyes would open wide when they realized that the small little signalments that these animals would give is a big deal. And, just to show them the tactics of how to work around it to kind of lower the chances of stress and to lower the chances of blowout just really helps them in the future. Um, there was even one incident that I remembered that somebody was petting this one dog that was in there for heartworm treatment, and I saw the body stiffen, and I was like, "Oh no, you need to back up now. You need to back up right
Yeah.
now." And as sure enough, as soon as she took that step, thankfully she followed what I said. Yeah, that dog went, "Bah, bah, 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 bah," you know, and I was like, "Oh my goodness, that could have been horrible the way that dog built up." But yeah, like I said, you do have
And
wiggle room.
yeah, and they can also, animals, they can feel your energy and they can feel your confidence too. And if they have that little wiggle room of, negative energy, or maybe you're not as confident in what you're doing, like animals can sense that and they can be like, "Oh, I can take this. I can do anything to make them stop this," and they're most likely going to stop. Whereas they feel that more confident energy, they're like, "Oh, okay, I'm going to back off. This person knows what they're doing and I need to behave myself."
Yeah, and I always taught low stress handling, so we always try to find ways to show them how to do everything with as close to minimal restraint and as close to minimal stress as possible. But we had to do it without the staff getting injured. That's was what was
Right.
important. Yeah, you're right. The staff's attitude and the staff's personality, yeah, it does impact the animal. I always had to watch the staff very carefully to see, and you always had to pick the right patient for the right staff, especially when you're new.
Yep. Yeah. Is there any other advice that you would give on somebody wanting to start their own business, or was that your number one?
The other recommendation is to talk to. There's a free resource out there called SCORE, and they're government a small business support company. They're local. Go out there and take advantage of it. Like I did, and I'm very glad that I did. And I go and talk to this person monthly and show them my financials, so that way they can help me grow my business. But, like, before you even start your business, go talk to a SCORE representative and show them your business plan, your business idea, everything of that sort. So that way they can say, "Yeah, this needs a little bit of work. Yeah, okay, this is good. This is good. I see that you have a plan in place." But, listen to their critique. Don't take it personally. But they are really helpful. That is a free resource that we should take advantage of.
Nice.
Awesome. And is it SCORE, SCORE?
Yes, it's SCORE. Like, the companies like, Verizon, Bank of America, et cetera, they're the ones that's paying for it because they really want to help these small businesses, you know, start and grow.
Oh, wow. So anyone in any state can contact this program
Correct.
and get help.
Correct.
Wow. That's awesome.
That's nice. Thank you for that advice. I haven't heard
Yeah.
of them.
Yeah, we'll add that into the show notes as well.
Yep. I got it marked down here for us. Okay.
Awesome.
Okay.
All right. What is one part of the job that you wish people really understood about owning your own mobile veterinary nursing business?
Yeah, for the vets, I'm not out to take your business away, for one. That is one of the biggest things. I am not out to take your business away. I'm not out to take your clients away. I'm not risking. I have a license I need to protect. And so I'm going to take it very seriously, and I'm not going to do any treatment without your back. Two, I have my own insurance. Just in case if any vets hear me and here in Tulsa, I have my own insurance to back me up. So I'm not going to sit there and just point and say, they did it. If I make a mistake, I make a mistake, and I'm going to man up and use my insurance on it. Yeah. And three, I'm so glad I did talk to the board before I even started the business. So that way I can find the legalities of what I am and not allowed to do. So I think Kathy was probably like, "Oh goodness, here comes Rulebook Rita coming in, asking some questions." Three, I did double check with the board to see what I was allowed and not allowed to do. I didn't just jump into this blindly. And I'm not trying to do this recklessly. I'm trying to do this to make sure that one, I lighten your load. And two, I'm making sure that your clients will stick with you and keep the bridge connected with you and your client. I'm trying to keep the bridge maintained, not trying to work against you, not trying to take your business away. I'm just here to help. That's all. And trying to fill in the gaps of any misunderstandings. Because I notice that sometimes there's a little bit of a misunderstanding and some clients take it personally, and I have to kind of explain it down.
Yeah, that's a big one. I get that a lot where a lot of clients will take something kind of personally or they feel the vet was picking on them, and I have to explain that no, they're just explaining it for this reason. Sometimes it's a CYA thing with the vets where they have to give you all these options, knowing that you're not going to take all of them, but they have to do it for legality reasons. No, they don't think you're a terrible pet owner. Yeah, I do a lot of that explaining, just as that same type of explaining you do.
Yeah, and then there's also too, I'm not giving the clients certain resources to question you too. I'm just offering them, like, showing them that there's options that they can talk to you about. For example, like if there's one medicine that they can't get down on their pet, I showed them maybe there's others. So that way they can come and contact you and talk to you about it and see if it's an option or not. And sometimes you could just say, no, this might not be a good option. Because I always tell them, talk to your vet. If they say no, follow what they say. They went through 8 years of school. I only went through 2 years of school. I'm just kind of giving you I'm just trying to open up a door. But if they slam it shut, follow what they said. They went through 8 years of school. They go through 20 hours of CE every year. I only go through 10 hours of CE every year. I only went through measly 2 years of school. They are the ones you have to follow. They are the leaders you follow. I'm just kind of opening up some books for you.
Yeah, I think it's amazing sometimes how you hear, because I know Michelle has had some backlash from specifically veterinarians. And it really baffles me sometimes that there are some veterinarians out there who are frustrated with what we are trying to do, because aren't these the same veterinarians that are complaining about how they don't have enough time in the clinic and they're rushing from 15-minute appointment to 15-minute appointment and they don't have time to talk to their clients? And it's like, how much better would it be if they weren't having to deal with, if the technicians weren't having to deal with nail trim appointments and anal gland appointments and giving medications and sub-Q fluids? You can spend so much more time on other quality things. And I'm not saying that what you guys aren't doing isn't quality. It is quality. That's why a lot of people are going to veterinary clinics to get these done. But they're so bombarded with all these other things and they already don't have time to have these conversations. But how much more time would their technicians be able to do more client communication if they weren't having to focus on these other things that you guys are doing with your personal businesses?
Exactly.
Agreed.
And what? Do not consider nail trims as something below your means. I saw a Facebook post of somebody in the comment that was an RVT, and it was like, it's below my means, and I'm a mobile RVT.
Ew.
It is not. Here's the deal: anal glands and nail trims are not. What you don't realize is the position of the paws, the conformation, super important. That is medically important. Medically important. And that does impact it. Sometimes some vet clinics don't have enough time to reassure, comfort, and work with the pets individually. Otherwise, I wouldn't have a physical therapist contact me and ask me to work with these pets on certain nail trims. Conformation is very important on those nails and how they impact the position and posture on those animals. Anal glands, very, very important, because if it wasn't for us, there would be a bigger medical issue like fistulas. And not just that, but if it happens a little too often, we need to tell them to go talk to their vet about looking at their back, and make sure they're not having arthritis that's affecting their posture, or that they need to talk to their vet about diet and adding a little bit more fiber to their diet, little things like that. So do not allow people to think that nail trims and anal glands are something below. No, it can be a bigger issue if we are not there to maintain it. And yes, I'm very glad that we're doing it instead of the clinics, because we have the time and the resources and the comfort that those animals need. And I tell those clients too that it's not the vet's fault that the animal got a little bit scared during their time at the vet clinic with their nail trim experience. Those vets, they only have a certain amount of time and resources that they need. we have a lot of time and resources that we can do to give as much comfort as to them as we can.
Yes, and I also wanted to make a huge point about that, Daphne, as well. When I did work in general practice, the amount of traumatic anxiety and it just wasn't good energy when we were having to perform nail trims with these pets, bringing them back, having to muzzle them, or doing anal glands and the dog screaming and then there's anal glands everywhere and the technician's all scratched up and then you're forcing the dog down just to get them, and you're just doing something as simple as a nail trim on the anal glands. And I I'm not working with you guys. I'm not in there with you, but I'm assuming it's a completely different experience from what I experienced when I worked at a general practice when you're forcing these animals because you only have a couple of minutes to do what you need to do, and it's traumatic for them. And I'm assuming that with what you guys are doing, it's a whole different experience for these guys, and that's so much better for them.
Yeah, I consider it. I've been calling it boutique medicine. Actually, one of my clients, she is a human nurse who worked from ER, and now she does aesthetics. And she was like, "Me and you, we do boutique medicine." I'm like, "You're right. It's boutique. We're in a relaxing environment. The patients are happy. The owners are happy. Everything's calm. Everything's nice." So yeah, I think what me and Daphne are doing is kind of like a boutique medicine. I don't think we should say medicine. How about boutique nursing? We are doing boutique nursing. A calm, relaxing, happy environment. The dogs feel good. The owners feel good. We feel good. It's a totally different situation. And then 2 points that I wish the veterinarians would look at, feeding off of what Jen said. Here's the thing. If you're bringing your dog into the vet once a month or once every other month for a nail trim and they're freaking out, they hate it, the techs are wrestling them, what do you think's going to happen to that pet over time? They're going to start associating the vet clinic with negative stuff that they don't like. So then when we need to bring Rover in for x-rays, now the dog's all ramped up thinking, oh man, they're going to touch my nails. It is doomsday. And then you have to sedate them and then you have to, and it's just a big mess.
Yep.
And it's like, if we're afraid of the vet, we should not be going there for nail trimming, because then when we need to go in there for something important, when they're sick, it makes for a worse situation. Number 2, I wish these vets would look at is, let's talk money. Money is the root of all, right? If you have X amount of staff, and most clinics are short staffed these days, they're thinning out, they're trying to be profitable. You have 2 techs. Would you rather have those 2 techs doing a nail trim or an anal gland for, I don't know, $20 to $50? Or would you rather have those 2 techs doing an x-ray for, I don't know, about $120 to $150? What makes more logical sense? What would you rather fill your books with? Nail trims and anal glands or x-rays and diagnostics? Like, where's the money leading you? So those are 2 reasons why having folks like me and Daphne out there is helping the vet clinic. And my God, we are not your freaking competition.
Exactly. And there was like one case that I had, and oh man, it breaks my heart just makes me cringe and makes my heart to think about it. But this dog required sedation and 2 staff members to pin this poor dog down and nail trims. And what it required me, was like one client holding baby food with some churros on the end. And yes, I did have to like suspend it. I know it's like Dr. Becker's against it, but what we found out is when we suspended it, it relieved a lot of arthritis off that dog. And that dog didn't want me to touch his feet. So I was only able to kind of tap around the toenails, barely touch around the toenails. And that dog was like happy camper just for me to tap around that toenails, relieving a lot of that arthritis because he didn't have his, he wasn't forced to stand. He was suspended. It was kind of like a hammock, a comforting hammock. And you see his eyes kind of half closing. But after we were done with the nail trim, I was almost to the point of tears because just to see that dog have a comforting experience where he didn't need to be sedated, where he was about ready to take a nap and enjoying the churros inside the baby food. The owner and I were just super pleased because he didn't need to go into that vet clinic where people had to pin him down, where he had to be drugged. He was having a very
Yeah.
positive experience where, he was, for the first time in a long time, he was getting his arthritis relieved by, getting weight off of him. So I think it really does help the pet, and it really does alleviate the owner's worries.
Yeah, yeah. I'm a huge advocate for it, absolutely. And I mean, and that's I'm gonna be honest, that's one of the reasons why I did get out of general practice and into emergency. And even now, like if I have to force a dog to do anything, I'm like, no, we're not, no. This isn't worth it. And especially for nail trims and anal glands. I mean, to me, that is absolutely not worth it. And it's not worth stressing out the dog over. And there's better ways.
There is.
Come on. I mean, there are better ways. And obviously, I think that it's very clear that veterinary clinics do not have the time to do what you guys are doing. So they should be thankful for you. And I'm thankful for you guys. And I'm really hoping, I don't know of any mobile veterinary nurses that I have in my area, but I think with the more that we talk about it, hopefully this can become, more of a thing, and we can see more of this, and hopefully we can get veterinarians to be more supportive of it and get them to see why. It's not about taking money from your pocket. I mean, and so, you go back and forth. The vets aren't in it for the money. We're not trying to take money away from you guys. We're not trying to take clients away from you guys. We're trying to help advocate for that relationship with you, and also trying to help advocate for the pets themselves and what's going to be best for them.
So, given all that we just talked about, especially with the DVMs, what is one common myth that you wish people would understand more about the job?
The job, it's not as easy as you think it is. It's not a dream. Like, how do I say it? It's great as a last resort before you leave the field, but do not, unless you have like the people skills, don't jump into it. If you are thinking that you're going to have a successful business by being rude to people, forget it. No, that's not how it's going to work. You need to have the kindness, the ears, and the heart in order to work with these people. Other than that, if you don't have any of that, forget it. Don't even bother. And always try to put a good front. Watch your Facebook. I found out people are stalking me on Facebook. Watch your Facebook. Watch your TikTok. Watch everything. If people are going to even add you as a friend, make sure you switch it over to acquaintance. So that way they don't see you on friends' posts, just in case if you need to event or anything like that. That way, if you post anything on public, like if you want to post anything to share anything great, put it on public. But, you're human. Yeah, we get it. But be careful about that. I've come from a Korean culture where reputation is huge. I'm always in a big fear that one little stumble can make a huge, big impact. So be careful what you say, and be careful what you post, because that may come back and hit you.
No, you're right. And it just takes one disgruntled client, one negative interaction for stuff to go crazy viral within your community. And next thing you know, everybody, and luckily, knock on wood, it has not happened to me, but I've seen it happen to other small businesses in my area where if something stupid was, it's just the weirdest thing. And next, their reputation is tarnished for at least the next couple of months because some person got upset with them. I'm like, so you're right. You got to be really, really careful about how you act on social media. Very careful.
Yeah, which is why I sometimes even say it's kind of a risk sometimes when we do this podcast, because there's conversations that we have on here that are a little bit controversial. But at the end of the day, me and Michelle have said that we stand by, what we stand for, and we are going to fight for that. We are going to speak on it. But you definitely have to do it in a very professional and tactful way, because it definitely can hurt you.
Yeah.
Sometimes.
And when you talk to clients, try to do it as very gracefully as possible. Yeah, try to do it very soft and as gracefully as possible. There's times where I'm like sitting there going, okay, I'll be honest with you. I might have to throw everything on the table here. So I have to throw everything on the table. But like when there's like hard opinions where clients are asking for my opinion on what to do, I'm like, it's not my job to state an opinion here, but I will put everything on the table so you guys can make the choices that you think is right.
Right. Do you find it difficult sometimes and find that clients because I know in the past, because I had a nutrition business for a while, and I ended up having to stop that because of my relief business and because of what I'm doing here. But sometimes there was that difficulty of telling clients facts versus what they wanted to hear. Because if sometimes clients just want you to reaffirm what they think is already correct. And do you see that a lot in what you do?
Yeah, I do. And here's the deal, like, you can't just, like, drastically just go over there and say, "You have to change this now." You can't. There's
Right.
no way.
Right.
That's not how it's gonna work.
You have to have that conversation.
Yeah, and you have to be small. Like, in order to influence change, you have to kinda slowly chisel a little bit and a little bit and a little bit away. I'm not the
Exactly.
and I always tell clients, don't expect to move mountains or move mountains. Just move a little anthill at a time. And so in order for me
Mhm.
to, like, sometimes have to change the clients and their opinions, I just kind of have to slowly, just kind of do a little bit here at a time and eventually kind of influence them. Even if they have a strong opinion there, like on how they feel or think or anything like that, cuz I kind of have a little bit of opinion. How do I say it? I don't believe on, like, nail trims you need to do any corrections on that. I'm kind of a big no-no on that. So I always kind of have to say, well, don't, you can do this instead. I don't say don't do that. I just go, why don't we do this instead? So I try to be a little bit more softer on that because if you just kind of like just flat out just go, don't do that, how I would feel pretty insulted. So always try to approach with a little bit much more patience. Even if you disagree, sometimes there's moments where you're just going to be like, okay, I might have to lay this on the ground and just kind of leave it be. I'm not winning this battle.
Yeah, choose your battles.
Yeah, choose
Yeah,
your
a little
battles.
bit.
Yeah. And then approach it with sugar. That's what I do. I try so hard to approach with sugar, and there's been times where my clients do stuff I don't agree with. And I approach it with sugar and sweet, and I say, I know you really care about Fluffy and Fido. I can tell you've done a lot of research. However, from my experience, this is what I would do, you know. But then I kind of try to drop it right after that and be like, so what you watching for TV tonight? Like, I try to immediately change it after that because I would at least want to, sandwich it, compliment them,
Yeah.
let them know they're doing a good job, but then try to tell them based on experience that you've had, this is why you'd recommend it. And then I did have one question going back to the types of people that would not be good for this, like technicians, what you need to be successful. Is it safe to assume, like, and we've all worked with those type of technicians who say, I just want to work in the back. I don't want to tech rooms. I don't want to do the vaccine appointments. I don't want to do the client education. Is it safe to say that those type of technicians, and everybody has a reasoning, some people just don't want other people, would not be good for this type of business?
Absolutely not. Because I was
Me.
one of those clients. I was one of those technicians.
You were one of those
Yes.
technicians? Okay, that's good to hear. That's refreshing.
So
Okay.
here's the deal. I was actually one of those. I started out as one of those technicians that the vets would have to shuffle me in the back. The vets would be like,
Really?
yeah. I was the one that specialized in anesthesia and surgeries because I was really good on those skills. I was really good on keeping those patients calm and relaxed. And yeah, but like my bedside manner at first was not that great. Yeah, it took a little bit in order to learn how to be a little bit more patient and graceful with it. Like I said, it took one vet to teach it. And then when I worked at the shelter, um, I will admit, I'm very graceful with my clients and very kind with my clients. But with the staff and other at my job, I was sometimes a little bit harder with my words. And I didn't mean to be harder with my words, but I just was. So hence the reason why they always put me in the dungeon. I always called it the dungeon. So one, because I was really good. Don't cringe, guys. This is shelter medicine. But me and the vet were able to do about 30 surgeries a day. I was very resourceful on that.
Skill.
Yeah. And so, and two, because it would cause a lot less drama. Apparently, there was a lot of warning that the staff members would say that Daphne was mean and she's just harsh and everything like that. When in reality, I was just I thought I was giving kind, constructive criticism. Apparently, it wasn't very kind with my words.
I think sometimes they get that confused with firmness because I've gotten the same.
Yeah. And so, like, but they make
And
it mandatory
straightforwardness.
to train with me for a week. The irony behind this. And then they would be like, "You're not as bad as people warn you as." And I'm like, "Wait, there's a warning?"
Yeah.
But yeah. Um, yeah. So I remember even one time, like, the shelter manager even put me in the room and was like, "I'm not putting you in the meeting anymore. You're just no, I'm not even putting you in in a meeting with other people anymore because your mannerisms is just not good for the higher ups." When I was just basically throwing everything on the table to the vet staff, because we were without a vet, and asking, "What are you guys doing for me to help?" You know, and apparently that wasn't very nice and very graceful. When I just wanted cold hard facts.
Yeah.
So no, I would
It makes
say
sense to me.
no. I say you can change. You can change, and I'm still
Okay.
an introvert. It takes a lot, you know, just open up your ears a little bit more and just work with a little bit more grace and compassion.
Okay.
Well, and it
That's
sounds like if you are going to be one of those technicians, it sounds like Daphne, you were self-accountable for that. You also self-reflected and you realized what you needed to change and then you changed it, which I think is difficult for a lot of people to do, not only in vet med, but just in general, like in life. So when you get told that you're coming off a certain way to certain people, because I've been told the same way, and then, and then I tell people that I know that like me, and they're like, oh, you don't come off that way to me at all. It's like, okay, but I come off that way to somebody. So I still have to self-reflect and I have to sit in it and I have to think, okay, what am I doing differently? Because I will say I do treat people differently depending on certain things. So yeah, I mean, I think at the end of the day, you have to self-reflect on yourself though. And when people are giving you constructive criticism, you can't just shrug it off and be like, well, that's what they think, but I know I'm not like that. Okay, but somebody's seeing you that way. And it's hard to do that sometimes, to sit in that.
Yeah, and my husband even told me, like, there's times where he kind of gets offended and then he's like, wait a second, her wording doesn't mean that way. So he kind of has to stop and think it through. So,
Mm-hmm.
there, when I was struggling, I actually went to a counselor. And this is advice. If people are telling you and they're taking things personally and you're actually taking things personally and you're struggling, go get help. It's okay to go get help and admit and see if it really don't think it's all them all the time. Sometimes it might
Right.
be you, and see. Because there was like some moments I realized it was me. And then there was some moments I realized, I had to stop and realize, okay, we're having some different personalities here, and we might have to figure out how to work around
Mm-hmm.
this. This is an awkward dance right now. Let's figure out how to accommodate our dance moves here. I had to even like evaluate human behavior a little bit to to make it a little bit much more. And so I actually had to stop, take a few steps and go, okay, you know what? I know how to train dogs. Let's train people like I train dogs. So I did a lot of words of affirmation to a lot of people and made it very positive reinforcement to them. And so
Yeah, it makes a
yeah, it
difference.
really does because the kennel staff at my last job, they were struggling. And they kept on getting critique after critique after critique. So I kept on saying, "You're doing great. Good job. Wonderful job here." I'm like, I know you're struggling,
Mm-hmm.
but you're doing great today. Here's what you're doing is good." And I'm having to choose my battles like, I know they're struggling here. We'll work on that later, but we're going to pick on what they're doing good right now. So yeah, go
Mm-hmm.
get help if you think, if you're realizing that you're arguing too much with people, because you may not realize it, but sometimes it might be you. And if it is, it's time to kind of work and take a step back and learn how to empathize.
Yeah. So, I mean, it sounds like you did a lot of work on yourself before you even stepped foot in even thinking about owning this business. And I think that's proof in and of itself that to be a business owner, you really, really have to dive deep into yourself, and you have to self-critique, And I know that we all do that anyway, but in a sense, when other people kind of tell us what we need to work on, we automatically become offended, or we automatically dive deep into our shell and we think there's something wrong with us and I think that that is a normal reaction, but it's what you do next with that information. Are you just going to sit there and be like, well, that's what they think, but I know I'm not like that, and whatever, they're just intimidated by me, or, you can make any excuse in the book, but at the end of the day, what you do with that information is going to either help you progress and excel into your next step, or it's going to hinder you. And if you do decide to be a business owner and you are getting these criticisms, you have to sit in that and you have to work on it. So I think that that's a big eye-opener there.
Sure.
So with all that being said, what is your top strategy for success?
Top strategy, get to know as many people as you can. I'm always going to say connections. Get to know as many people as you can. I have facial blindness, so I don't know anybody outside of their natural habitat, believe it or not. So if you guys ever come up and greet me, please tell me who you are. And I actually tell people at the dog shows that if they are going to come and greet me, I'm very shy. I always tell people, I'm very shy. Please come up and talk to me. Come up and talk to me and tell me everything. So that way, as I'm listening to their stories, I can pick up their stories and then get to know them a little bit more. But remember their stories and remember who they are, but also talk to them too. But get to know as many people as you can. Don't do huge favors, but do as many small favors as you can too, because people will remember those. Not like huge, like ridiculous favors. So, like when I volunteer a little bit at the shelter, now they're like referring fosters over to me. I've had a few clients, paying clients, that have called me over, and I also got involved in a big spay and neuter event too that I got paid very beautifully on. um, one day. So have a good relationship and make sure that you keep in positive contact with them. Yeah, there's probably going to be a few burnt Cheerios that, you're not, no matter how much you do, you are not going to please. And sorry, it's going to be hard. You just kind of have to toss them to the side.
Yeah.
Yeah, toss those burnt Cheerios to the
Yeah.
side, but just try to make as many people as happy as possible. Sometimes you may have to keep your mouth shut, keep your head down, just keep going. And it may be hard. I'm not religious at all. Sometimes pray for your enemies. That's the best you can do on those bad days.
Yeah.
Yeah, I
Yeah,
pray
that's
for them
true.
all right. My favorite wine is revenge. Like, yeah, I pray.
I believe in karma. I just kind of silently step back and just kind of watch things happen. But I'm really bad. I'm that bad person that just never tells you if you're my enemy or my friend. I'm just always going to be kind. No matter what. Don't worry, you guys are good. It's kosher.
Okay, that's just like, okay.
Keep them guessing all the time. I think that's
Yeah.
what's best.
Yeah.
Yeah.
Yep. Yeah. Well, Daphne, this has been a very enlightening episode. You've actually taught me a lot. I've learned a lot from you in this episode and a couple of actually wonderful resources I didn't know about before. So I think this is going to help a lot of other mobile vet techs, especially the ones who do love behavior and might want to build something out of that similar to what you have. And since this is your episode, is there anybody in particular that you want to dedicate your episode to, who's helped inspire you, or somebody who's made a difference in your life, or a pet, or somebody that's passed on? Who's that somebody special that you want to acknowledge today?
I thought this long and hard, and I think it's going to be my friend Joanne. I haven't seen her in many years, but she went to RVT school, and if it wasn't for her, I would not be in RVT where I am now. I honestly thought I was an epic failure. I went to college to be a vet, and when I kept on failing class after class after class, I was like, I give up. I'm done. I'm a failure. I'm not going to go any further. And she kept on pushing me to RVT school and kept on educating me and just kept on giving me like all these random medical facts. And eventually, when she just pushed me to go to RVT school, she and I were screaming at each other, yelling and screaming at each other. And I was like, fine, I'll just go to RVT school, but I'll show you, I will fail. I will fail. And I didn't. And she's the one that personally drove me to take my California's state board test, you know? And if it wasn't for her, I wouldn't be here. And I owe her a lot of thanks. I just owe her a lot of thanks for helping me get that stepping stone up.
Well,
Yeah,
thank
me
you very
too.
much, Joanne. I hope you said you haven't reached out to her in a while, but I think it's due time. Maybe, you just never know when something small that you do is going to impact a person, who's going to impact more people, who's going to impact something big. So she probably would love to hear from you. Just be like, hey, you were important to me, and here's what you did for my life, and thank you.
Right.
And that might just make her so happy to hear that.
Yeah.
Mm-hmm.
She and I always got into a lot of heated arguments at work, but man, we were very good to each other.
That's awesome. I love relationships like that, though, because that's when you know that they're real.
Mhm.
That's awesome. All right. Well, this was an awesome conversation. Daphne, thank you so much for coming on and talking to us. And this was really an inspiring conversation. I really enjoyed this conversation, and I think a lot of people are going to get a lot out of it, especially within the mobile vet nursing aspect of it. And just, yeah, I think this was a great conversation. Thank you again so much.
What an honor to be here. Thank you guys so much for your time and everything.
Of course. Of
Thank you
course.
for coming. Well, that's a wrap, everybody, and we'll see everybody here back in a few weeks. All right. Thank you, Daphne.
Thank you.
Thank you so much for tuning in to Endless Journeys, the VetTech Odyssey podcast. We hope you enjoyed today's episode and found some valuable insights. If you did, be sure to subscribe so you never miss an episode. We'd love to hear your thoughts, so please leave us a review and let us know what you think. You can also connect with us on all social media platforms at Endless Journeys, the VetTech Odyssey podcast. Until next time, keep learning, keep growing, and keep making a positive impact in the veterinary world. We need you guys. Have a great day.